So next we're going to take a closer look at the overlapping symptomology between trauma and a lot of the common mental health diagnoses that you see in children. You'll be able to reference these charts in your guidebook, and after we go through the charts, we will then provide a lot of examples of how this really presents itself, either in home or school settings. So as we look at this chart, you can see the mental health disorder listed and then the overlapping symptoms in the middle of the chart. The diagnosis that we hear more often than any others, and the one that we have mentioned in previous courses, is attention deficit hyperactivity disorder. We know that the overlapping symptoms and reactions between ADHD and trauma are significant, but some of the main overlapping symptoms are things like restlessness, hyperactivity, kids having very difficult time concentrating and focusing, having a lot of hyper-vigilant behavior. Another very common mental health disorder that we see in children is oppositional defiant disorder. The overlapping symptoms between ODD and trauma are things like angry outbursts and intense irritability. And then of course you see that defiant-like behavior. Then with the anxiety disorders, and anxiety disorders include social anxiety, obsessive compulsive disorder, generalized anxiety disorder. The overlapping symptomology between anxiety disorders and trauma is significant, and we will go through a lot of examples. But what we often see are avoidance of something that that child is fearful for, hyper-arousal, a lot of sleep problems, hypervigilance, and startle reactions. With major depressive disorder and the overlapping symptoms between depression and trauma, we see things like self-harm. We also see social withdrawal. We see a lot of numbing. And you can see how that is sort of teetering into those at-risk coping behaviors. As we move into disorders that we haven't talked as much about in other courses so far are things like bipolar disorder. What are the overlapping symptoms between bipolar disorder and trauma? We see a lot of either way hyper-aroused or then into that collapse mode. So we know that we see kids that kind of seem like they're on a roller coaster. That is a very telltale sign that people think is common with kids with bipolar disorder, but what we know about social engagement is that we see that in our kids with trauma as well. Panic disorder, a lot of distress upon exposure to trauma reminders. So maybe they see something, smell something, hear something, and immediately that clicks on their central nervous system. And certainly it could look to many people who aren't trauma informed like a panic disorder. Substance use disorder, certainly drugs and alcohol used to numb out. We saw that on our infographic. And then lastly, and this is the one that can be very scary, is that there are a lot of kids who have significant histories of trauma who are misdiagnosed with having psychosis or psychotic disorder. In these kids, we see a lot of hypervigilance, a lot of flashbacks, re-experiencing. I know that I worked with one child who, when I said to her, "Do you hear or see things that other people don't hear?" she said yes, and it was related to the re-experiencing of the person who sexually assaulted her. So you can see from these charts how, if you're not trauma informed, you can easily just look at the symptoms and reactions and apply a diagnosis to the child based upon that symptomology.